I've written several times already on the consequences of well-meaning but misguided. It's a long trend of deinstitutionalization for people suffering from mental illness. Now, my family, unfortunately, just got to experience the outcome of that trend directly. Recently, a close family member of mine experienced a sudden and severe mental breakdown. And while he thankfully wasn't threatening to harm himself or others, he was in a state of agitation and paranoia so serious he couldn't be safely managed within a family household, though we tried. He wasn't capable of taking care of himself, and we couldn't keep him contained. So the decision was made to take him in for professional help and evaluation. This wasn't a situation, though, where you could just schedule an appointment and wait a few weeks to see a counselor or a psychiatrist. It was acute, and we needed immediate help for him. So our family member was taken to one of Calgary's hospitals, and we began through the emergency department. And just so you know, that's the only way to check somebody in during such an episode. As with pretty much all the emergency departments across Canada, it was busy, they were harried, and they were backed up with admissions. It took over 9 hours of waiting before a temporary bed could be found, and he was stuck in that temporary bed for another day until a bed could be found in the mental health unit for some better assessment and to seek treatment options. Now, it's just typical in our healthcare system. The medical professionals are fantastic. I mean, all the way from the people cleaning the rooms to the nurses to the doctors. They're hardworking and patient people, and they're doing a hell of a tough job. The problem is getting through the queue to get to them. The triage area of a hospital. It's by nature a chaotic and high-stress environment. It's unfair and unhealthy to keep somebody in a serious state of mental health distress in such an environment. And it doesn't do those waiting for physical medical help any favors either, being seated next to a paranoid, delusional person for hours. That's all the options we have right now, though. Canada's monopolized public health care model has evolved into a very hospital-centric model. We pack every type of specialty, treatment, and procedure into overcrowded and often poorly managed general hospitals, when many of these services could and should be provided in specialized facilities outside of the hospital. Now, one of those specialized services is acute mental health treatment. Calgary has a population or metropolitan population of 1.5 million people, yet it doesn't have a single generalized psychiatric hospital. Major hospitals, they all have wards dedicated to secured mental health treatment. And there's a forensic psychiatric facility for the criminally insane up by our prison. But there's no specialized facility for just general patients, even though so many people get touched by mental health issues. We recognize that pediatric healthcare is so specialized, we build children's hospitals, yet we can't accept the need for psychiatric hospitals. Now, psychiatric hospitals, they boomed in North America at the turn of the 19th century when it was noted that a large segment of inmates in the prison system were suffering from mental health disorders. Facilities were built to humanely house and treat people with psychiatric disorders, and initially that's what they did. Unfortunately, the facilities became dumping grounds for people the state didn't want to deal with over time, and funding began to run short. Conditions became inhumane and abuse was rife, and by the 1950s, 500,000 Americans were secured in mental hospitals. Canada had tens of thousands secured as well, and the conditions became unacceptable. That began the trend for deinstitutionalization through the 60s, and in North America, mental hospitals began reducing the size and closing altogether. But no new facilities were built, and the remaining ones were often outdated and poorly maintained. So as people were turned out into the communities with well wishes, they often didn't have much support, and we're seeing the consequences of that today. It's estimated that 25% of the homeless you see on the streets are suffering from mental health disorders, and as much as 15% of the inmates in prisons. While we don't like the idea of securing the mentally ill long-term in hospitals, can we keep pretending they're better off in the streets or in jail? We've destigmatized a lot of mental health disorders, depression, things like that, and we should. It's time to destigmatize mental health hospitals. Extended stay mental health facilities, they don't need to be inhumane and nasty and odious as they used to be. I assure you, the current wards in existing hospitals are not good spots for people to reside long-term. Our healthcare system needs a lot of reforms. One big one, though, would be to decouple mental health wards from general hospitals and build facilities that can provide comprehensive mental health care services, from admission to evaluation to day treatment, and yes, possibly secured treatment if need be. Specialized facilities can offer much more effective treatment and take the pressure off of the hospitals. Committing somebody is and should always be a last resort, but we need to have that option available at need, and quickly at times, even if we don't like to think or talk about it. I understand we want to respect people's dignity, but there's not much dignity remaining when a person's on the streets, in jail, or possibly even dead for lack of mental health treatment facilities. Had my family member not had the family support he had, I'm certain he'd be facing one of those fates right now. So again, guys, it's time for some frank talk and treating the people who are suffering from mental illness as the illness it is, and the illness that needs specialized, separate treatment, because they're falling through the cracks And it's not like we aren't paying for it anyway. We pay for it. It's just that we're paying for it through our prisons, through our regular hospitals, and again in homeless supports. So either way, we're still hoping for the best for my family member. He's still incarcerated in there right now, and many other families are dealing with this. I just wanted to get that out there and remind people: healthcare reform comes with a lot of other aspects beyond just the physiological area of it.